Hey everybody, it's the Rain Man, host of RAINMAN'S Take podcast, observations on the world we live in, coming at you today with another raindrop. The topic for today is going to be my take on the current coronavirus situation, how the numbers that we're hearing on the news, how they're impacting things, and what my take is about that. First and foremost, let me just say I'm very frustrated with the way things are going. It's a shame that this situation has become completely politicized to the point where it's tough to watch. It's tough to watch the news right now, but you have to keep informed. As I always say, you got to listen to both sides and then make your an informed decision at that point. And the truth usually is somewhere in the middle. So, real frustrated, and one of the main causes of that frustration is basically the statistics that we're being told. And how those statistics are being used to A, support a narrative, and then B, dictating how our governments are treating this, and how this whole lockdown has been put in place. For me personally, I am in the camp of we need to get things going again. We need to get America opened as quickly as we can. And thankfully today, May 22nd, Friday, it sounds like there are several states that are going to be reopening again, and so I'm all for that. Caveat to that is I'm all for it, doing it safely. I still think we need to wear the masks, at least for the time being, social distancing whenever we can, extra hygiene, washing your hands, that sort of thing. I still think those things need to be in place, but we need to be able to get out there and start getting our economy going again. Before I get into the numbers real quick, I also want to say this. By no means am I ignorant of the fact that there's a lot of pain and suffering going on right now, and I really feel bad about that. But with that being said, I still think that we need to get things going again, because I personally feel that the economic devastation that is coming, I think, is going to cause a lot more pain, a lot more suffering than we currently exist right now. So, with all those things being said, I've got several articles here. I just want to read off a couple of things just to kind of make my point here. First and foremost is the frustration with the initial modeling that had come out. And I think the news took this and ran with it in a way that basically scared people. I don't know if that's what they were intending to do, but they took numbers that now are being seriously questioned and ran with them as if they were gospel. So a couple of examples. First and foremost, the original modeling that came out of the Imperial College in London by a scientist named Neil Ferguson has been very challenged of late. If you remember, his original prediction was 2.2 million people in America would die from the coronavirus. Obviously, over the last couple of months, that number has been redone and adjusted down significantly since then to where it is roughly today. So a couple things that were said about that modeling that came out of Imperial College. Quote, "The more evidence is emerging that calls into question the models, what the public often refers to as science, which inspired governments across the world to impose crippling lockdowns on the population. A number of data scientists have taken a close look and found gaping oversight that seriously undermine the model's credibility." Of course, this isn't the first time that Ferguson has come under scrutiny. I believe he was also one of the original modelers of the climate change argument, and a lot of his modeling with that particular instance have also come under question. So keep in mind that the Imperial model is what ultimately inspired Prime Minister Boris Johnson to make a U-turn and adopt what has been an economically devastating lockdown with nothing short of a catastrophe. Millions have been plunged into hardship and poverty unnecessarily. Since the publication of the Imperial's micro-simulation model, those of us, this is what we're talking about, the authors of this particular article are both Englishmen. Those of us with a professional and personal interest in software development have studied the code on which policymakers base their fateful decision to mothball our multi-trillion-pound economy and plunge millions of people into poverty and hardship. And we were profoundly disturbed at what we discovered. The model appears to be totally unreliable, and you wouldn't stake your life on it. So that's one. Two is a couple months ago, and this is an article from the March 20th. This was Gavin Newsom, who's the governor of California. This was Governor Newsom's original projection for this, and this dictated a lot of what he actually ended up doing. He predicted in March that there would be 25.5 million people with the potential of more than 5 million people requiring hospitalization. Obviously, that was way, way, way out of what the reality is here in California. I think to date, California has something like between 2,500 and 3,000 deaths from the coronavirus. So, again, the initial modeling, the initial numbers that were coming out, I don't know if they intended them to just be used for scare tactics to get the people to kind of go in line with what their governments were imposing on the population. I don't know if that was the original intent. If it was based on very questionable data. So that's the first thing, just the frustration with that. Secondly, or next up would be kind of what the current state of the numbers are, and again, this is also where I'm frustrated, because the numbers that we get every day of the number of cases, the number of deaths, those also have come into question. And here's an article that was authored by John Lott and Dr. Timothy Craig Allen. This was over in Town Hall. One of the main things that they said was that it's inaccurate reporting of the numbers that we're getting every single day. And here's an example. New York is classifying cases as coronavirus deaths even when post-mortem tests have been negative. Despite negative tests, classifications are based on symptoms, even though the symptoms are often very similar to those of seasonal flu. The Centers for Disease Control guidance explicitly acknowledges the uncertainties that doctors can face. When coronavirus cases are suspected, they advise doctors that it is acceptable to report a COVID-19 on the death certificate. This isn't just a theoretical issue. On April 21st, when New York City's death toll rose above 10,000, the New York Times reported that the city included 3,700 people who were presumed to have died of the coronavirus but had never tested positive. That's basically more than a 50% increase in the number of the deaths that they reported. Dr. Bricks from the CDC has also stated publicly that that was the CDC's guidance to it's almost like when in doubt, there is no doubt it's coronavirus. And so right there, the numbers are a little bit skewed in my mind. A couple of other things that this article talks about, that there are additional reasons for concern with these numbers. First and foremost, some doctors feel pressure from hospitals to make the cause of deaths due to coronavirus. And the reason for that is there's actually a financial incentive in the CARES Act that was recently passed, as a 20% premium for COVID-19 Medicare patients. So unfortunately, it seems like there's almost an incentive to not only a financial incentive, but also to somehow make that number larger, the death toll larger from coronavirus. And again, I don't know why they are doing that. All I know is the numbers in my mind don't seem to be accurate. And again, keeping with, I'm just trying to find the truth. You got to look at everything and then make your personal decisions based on that information. So they conclude this article by saying it's hard to believe that we're basing such crucial decisions on such flawed data. So where do we stand right now? It seems like, at least my impression is, things are starting to loosen up a little bit. We're getting some downward trajectory in numbers and that sort of thing. And just when it seems like there's some optimism out there, boom, we start hearing about that the next wave could be worse than the first one. And again, this was from Zero Hedge a couple of days ago, and this is talking about a study that was done in the University of Washington School of Pharmacy. A gentleman named Anirban Basu, from the health economist, and basically what he said was that if the infection fatality rate is accurate, and if the coronavirus continues spreading at current rates, even before most states open their economies and relax social distancing restrictions, COVID-19, the disease caused by the virus, could claim between 350,000 and 1.2 million lives by the end of the year. Again, those are worst case scenarios. I guarantee you those numbers will get modified downward, but that seems to be the modus operandi, is large numbers, the sky is falling, and maybe that's because they need to scare people into the policies that they're trying to put out there. And finally, from this article, talks about the infection. And this is Mr. Basu himself even admits this, that the infection fatality ratio estimate is itself dynamic in nature. The overall estimate can both increase or decrease in the future depending on the demographics where the infections will be spreading. It is possible, as the infection spreads to more rural communities of the county, the overall infection fatality rate will increase due to lack of access to necessary healthcare delivery. So again, they're talking worst case scenario. I don't know of any state, and I could be wrong about this, but I don't know of any state that has said right now that go back out there and operate as if nothing ever happened. All I'm hearing on the news right now is the state leaderships, they're all saying we need to do it smart, we need to do it safe, we need to still do the social distancing, still wear the mask, et cetera, et cetera. So I don't hear people wanting to get back to the way it was, at least for the time being. As a result, I don't think these numbers are going to be accurate down the road. I could be wrong, we'll see. It just seems like they're using large numbers to scare people into compliance. So one more thing, and then I'll close it up here. There was a scientist named William Hasseltine, who was a former Harvard Medical School professor and founder of the university's Cancer and HIV/AIDS Research Department. He actually came out and came out against Dr. Fauci, especially in the current environment where multiple pharmaceutical companies are trying to come up with a cure for this thing, a vaccine. And his big issue was that none of these things are proven. They haven't gone through the rigorous testing process. And so any optimistic discussions about the potentials for these things is not helping the current situation. And he even goes so far as to say that the media also bears responsibility in this, because asking experts to opine on unsubstantiated claims is not useful. Medicine and science are not matters of majority opinion. They are matters of fact supported by transparent data. This is the backbone of scientific progress and our only hope to end this pandemic. We can't give up on our standards now. So there definitely are people out there that are going against the common narrative, and unfortunately they're being silenced. This is from newswithviews.com. A gentleman named David Usher wrote this article. It talks about ethical practitioners of respiratory viral science are correcting the pandemic of false information spread by entitled government experts such as Dr. Fauci and Dr. Birx. They have been heavily censored by Google, YouTube, Facebook, and the mainstream media. This is a gentleman named Knut Witkowski. He's a PhD and former head of the Department of Biostatistics, Epidemiology, and Research Design at the Rockefeller University Hospital in New York City. I'll just give you a couple of quotes of what he's been saying. First off, he's not paid by the government, so he's entitled to actually do science. We have a political pandemic, not a medical one. This happened because one person in Britain made a scary prediction of 2.2 million lives in the U.S. would die, and nobody in the United States dared to question the methodology. With all respiratory disease, the only thing that stops the disease is herd immunity. About 80% of the people need to have had contact with the virus to get immunity, and he said we need to get things going to get that herd immunity going as fast as possible. And then a couple other quotes here from him. If we are preventing herd immunity from developing, it is almost guaranteed that we will have a second wave as soon as we either stop social distancing or climate changes with winter coming. The second wave is a direct consequence of social distancing. And he finishes this off with saying that quarantining the sick is what we need to do, not quarantining the healthy. And then finally, an ER doctor from Wisconsin had a quote in this article. He says, I'm walking into this war zone. Our ICUs are empty. I'm scared to go to my own place of work. There's no patients, but we have people in hazmat suits checking my temperature when I walk through the door. There is something else going on here. This is not about science. When they say the word safe, it's all about controlling you. So, there are experts out there that have a dissenting opinion about what's going on right there, or what's going on today. And then finally, is the lockdown, when all said and done, will it have saved lives? I don't know. It's probably too early to tell right now. But this article, Jeffrey Tucker via the American Institute for Economic Research, has a couple of very interesting quotes. First one being is, so even if lockdowns slow the spread in the short term, it's not clear that they've saved lives from the coronavirus, even if it results in more death overall from deferred surgeries and diagnostics, suicides, drug overdoses, and depression. He also mentions the fact that 30 to 60% of these deaths right now are coming from nursing homes and some of our most vulnerable citizens. And that population that needs the most care has actually been the most neglected in certain areas, specifically New York, California, and New Jersey, where nursing homes were actually forced to take in COVID-19 patients. So, in conclusion, just want to read this final quote, and this was actually from Donald Henderson, who died in 2016. He was one of the physicians who was credited with the smallpox eradication. He says, the interest in quarantine reflects the views and conditions prevalent more than 50 years ago, when much less was known about epidemiology and infectious diseases, and when there was far less international and domestic travel in a less dense populated world. It is difficult to identify circumstances in the past half century when large-scale quarantine has been effectively used to control any disease. The negative consequences of large-scale quarantine are so extreme, being forced confinement of sick people with the well, complete restriction of movement of large populations, difficulty in getting critical supplies, medicines, and food to people inside the quarantine zone, that this mitigation measure should be eliminated from all serious consideration. So that's my take on the numbers, on where we stand right now, and my frustration with the whole situation. I hope you enjoyed this, and I hope you're also taking deeper dives into what we're hearing on the news, and deciding for yourself how you think we should move forward. So this is the Rain Man. Thanks very much for watching.